All living creatures need good health. If we fall ill, or if we are unable to provide our body with the care and nutrition it needs, we cannot survive. In Africa, millions of people are dying from treatable diseases because they are poorly nourished and lack basic health care. HIV, tuberculosis and malaria are spreading across the continent faster than clinics can treat them, despite the billions of dollars being spent on pharmaceutical remedies. The United Nations estimates there will be 18 million orphans in sub-Saharan Africa by 2012. In South Africa, these epidemics are extreme.
So in South Africa, 1 in 3 sexually active adults is currently living with HIV. Out of a population of 45 million, there's at least 5 to 6 million HIV-positive, HIV-infected individuals in the country.
TB continues to spread at an alarming rate, despite being a curable disease.
I think in South Africa, 5-6 years ago, there were probably 8,000 deaths from TB a year. We now have over 100,000 deaths.
The problem isn't a lack of drugs, but the inability of governments and health organisations to implement effective control programmes.
There's billions of dollars being pumped into all sorts of programs of prevention from the West, from all over the show, and the truth is most of them have failed. And the reason why they failed is that we started off with some basic assumptions that were simply incorrect and we never tested. One of which is that the average African has more sex than the average person in Germany or the UK or the US. It's simply not true.
We have learned the hard way, even if we knew in principle before, that you will not be able to manage a patient completely if you have not addressed their other means and their other challenges. And that includes nutrition, that includes social problems that they have.
The population we serve has got a lot of malnutrition, and they live in a pretty impoverished area with very poor soil quality. This means that they can't grow good quality crops.
Most children in Africa suffer from nutritional deficiencies. Despite this, the feeding of such children usually consists of filling their bellies rather than making them well nourished. Clearly, things must change, because without good nutrition, the battle is being lost. Every year, malnutrition in Africa kills 5 million children. That's 1 every 6 seconds.
The nutritional crisis is so enormous in Africa. You cannot dispense strong medical drug systems on highly nutrient deficient people. They just don't work, they're not effective. We talk about malaria, we talk about TB, we talk about HIV, and there's all of them have links back to nutritional issues.
There have been many unsuccessful attempts to fortify a nutritionally sterile diet of refined cereal with vitamins and minerals. In South Africa, where iron, zinc and vitamin A deficiency is widespread, their maize and wheat flour fortification programme has been a failure. But some organisations are making a difference. HETN is a British charity promoting good nutrition as a simple and effective way to save millions of lives. In partnership with progressive South African groups, they are taking direct action by providing feeding projects for orphans and vulnerable children with fortified food, such as EPAP.
EPAP is a pre-cooked food. It's based on what most people eat in Africa, and that's maize. We fortify it with soya. And we use a cocktail of state-of-the-art nutrients that is focused totally on bioavailability. That's the ability to be absorbed to the body. We were trying to deliver the 10-course meal, if you like, from a nutritional point of view, in a single step.
We know from a pure scientific perspective that an individual who has had good nutrition, good access to healthcare, even the most basic and fundamental of healthcare, that person has less susceptibility to infection.
It is very sexy to ship tons and tons and tons of surplus wheat to starving nations, when, quite frankly, it doesn't cost you a damn cent. It's surplus. What we're looking for is good food. What we're looking for is real nutrition.
EPAP does improve nutritional status and overall health, which is why HETN is focusing on it as an African solution to the many health problems linked to nutritional deficiencies. Providing fortified food has now become an important part of health programs.
Nutrition is probably one of our core things within the program. We can't do any activities or anything with the children or the adult people, for that matter, without giving them food first. The major component is around nutrition.
At a nutritional level, their immune system is automatically compromised as well. The more compromised your immune system is, the more susceptible to any kind of infection, not just HIV, all the other conditions that people live with in Africa as well.
Another way of making people aware of good nutrition is through South Africa's network of traditional healers.
We have an estimated 400,000 traditional healers and probably 20,000 trained medical doctors. What the number says is that 80 to 90% of every South African the first port of call will be a traditional healer.
Traditional healers are trusted by the community and have treated the sick with herbal remedies and psychological support since the dawn of time.
We are working with them to get to the community. So our whole approach is one, to show where we do have known science, to share our knowledge with them on the importance and why some of the products that they do use work.
Am I saying that nutrition is a cure for HIV? Absolutely not. What I am saying is that if my body has the resources that it needs, it will do its job properly. And the proof of the pudding is 25 years later, here I'm sitting in front of you, a relatively healthy specimen of a person living with AIDS.
The lack of successful disease prevention policies has hit the South African economy. Tourism, for instance, employs thousands of people, but HIV and TB have taken their toll. A South African company called And Beyond owns and manages hotels and game lodges in the country's national parks. In recent years, the company became so concerned about the health of its staff, it introduced a new initiative called Positive Health.
Our staff is our most valuable asset. When we started this program, we had a lot of presenteeism, where staff is at work, but they're not really there. They're tired, they don't have energy, family members are dying. It was a very negative, depressing atmosphere. And you could see that in productivity. People just couldn't perform anymore.
What the Positive Health program has done, it's actually opened doors to knowledge towards people. Their health is important. We want our staff to be here today. We want them here in 20 years, 30 years' time. So we teach them what is important food, what is good food. Then they will start incorporating that into their diet.
When I think of it as a manager, you need people that are healthy in your industry. You see, so if you see somebody who is sick, meanwhile you've got something that you can give to help that person. Yeah, it did affect you, and you don't want to lose your staff. During breakfast, we provide fruits for them, and the EPAP to boost their body as well. And even during lunchtime, they can have pap and meat, but it's also some vegetables to help their body as well.
The company encourages staff and their families to cultivate their own nutritional vegetable gardens. The practice has had a positive effect on this rural community, already decimated by HIV.
Some other kids, their parents passed away because of HIV. So as a result of that, we have a lot of orphans and vulnerable children. For us, as a non-profit organization, we are not able to hand out food. So what we are trying to do is to provide a skill on how to grow a good nutritional food at a very low cost and at a very simple method. And the children are involved here. They see how the food is grown up until they see the vegetables in their plates.
You concentrate on nutrition, the body, the mind and the soul, and educate people. They will be able to help themselves, and you're not just rescuing. care of the land, care of the wildlife and care of the people. It's like a three-legged pot, you know, if you take one leg away, it will fall over.
I think in order for us to have a meaningful impact in Africa, we need to start looking at nutrition as part of our prevention methods.
Many people look to South Africa as a beacon of hope for the continent. If you can't do it here, you can't do it anywhere.
HETN supports the work of those who understand this nutrition crisis. Together, we can persuade those in power that it is possible to make a real and lasting difference. Please help us to help them.